Hi IMG SOS candidates, and welcome to this presentation on the PEPEA exam, an entrance exam to enter GP training. I'm Monica and I'm one of the IMG SOS GP tutors for this subject. This is designed to be an overview of what to expect when you sit the examination. So in terms of the PEPEA format, you can expect 100 questions, all of which will be multiple choice questions, and to complete the examination in 195 minutes. So roughly 2 minutes per question is allocated. Half of these questions will be a situational judgment test question, and the other half will be basic clinical questions. And I'll run you through both styles of questions. Now, the situational judgment test questions, they may be new for some of you, but let's have a look at some of the examples. So there will be two types of SJT questions. One will be you are given 5 options and you need to rank in order all 5 options from the best option to the worst option, or some of the wording may be most appropriate to least appropriate. The second type of question in the SJTs is to pick 3 of the best options. You may be given a selection of up to 10 different answers, and you need to pick 3 of these answers as correct. These 3 answers do not need to be ranked from best to worst, but they need to all be correct. So what type of SJT questions can there be? They are usually based around a clinical scenario, and you are asked how you would react in this situation. Types of questions may be around patient safety. For example, you've made a prescribing error. How are you going to approach this? It may be an ethical dilemma. Perhaps there might be a relative who is worried about the patient in front of you. How are you going to deal with confidentiality and such? There might be patient complaints that come back to you, and how are you going to respond to a patient who might have made a complaint about you or a colleague, and what are the avenues of escalating these complaints? There might be issues around unprofessional behaviour. Perhaps someone has told you that a colleague of yours has been intoxicated at work. What will you do? There might be issues around healthcare barriers and questions around Aboriginal care or even refugee health. And do you know the resources and the best way of approaching our Aboriginal community? Or it might be questions around looking out for a colleague. Perhaps you've noticed a colleague is a little bit burnt out. How are you going to approach them? Now, this list isn't complete, but it's a good list to start you thinking. Now, when you read the stem for these questions, there's often competing priorities that you are looking at, and you have to make a decision about how are you going to order the priorities and which one is most important. Now, I think one way of thinking about the different priorities in these questions is to also think about the 5 domains of general practice. Now, these are the guiding principles behind our work. The first domain is communication skills and patient-doctor relationship. So this relates to how are you communicating to patients? Are you using a patient-centered approach and showing compassion? Are you thinking about the person as a whole? The second domain to think about in these questions is using your applied knowledge and skills. So are you using the skills and knowledge available to you to make rational decisions? The third domain is around population health and the context of general practice. So are you thinking about all the other social aspects of the case? Are you thinking about their family, public health, the community, the types of resources that are available to you and your patients? The fourth domain is around professionalism, and are we conducting ourselves in an ethical fashion? Are we putting our patient first? Are we reflecting on how we can improve our practice? The fifth domain is around organisational and legal dimensions. So do we know the avenues for escalating problems when we're practicing as GPs? Are we thinking about confidentiality? Are we thinking about the computer systems and how that can help us with our work? Now let's move on to clinical questions. So when we think about clinical questions, there are two styles of questions. The first is you're given 5 options and you need to pick the best option. The second style is thinking about extended matching questions. You might be given a selection of up to 10 different answers and you need to pick one option. So again, thinking about different examples of clinical questions. Now the important part here is to consider the aim of this exam is to make sure that when you enter GP training that you're going to practice safely and responsibly. So the level of these questions can be quite basic and rely on you perhaps recognizing red flag conditions, judiciously using investigations and resources around you in a GP practice. Examples can include a STEM and thinking about the most likely diagnosis, or perhaps picking an investigation to further work up a patient. Now, a first-line investigation may be different from a diagnostic test. For example, a middle-aged patient that attends your clinic with chest pain. Perhaps the first-line investigation will be an ECG within the clinic, but maybe the diagnostic test you need to organise is a stress echo. It will depend on how the question is worded. You can expect that there may be ECGs to interpret. There may be clinical photography as well, such as photos of a rash or another common clinical sign that you might have encountered in your experiences. There might be questions around management, and that could be around what medication you might prescribe for a common condition, or it may be what is your next action. For example, calling an ambulance for a patient or following them up in 1 week, 1 month, etc. I hope this was a helpful introduction to the PEPEA exam. There will be resources available to you through the portal as well. Thank you.